Morning. Thank you all for showing up. Today's focus will be health. It is our goal to end by 1 o'clock. I have Rules Committee at 1:30. Several committee members have other committee hearings, but we will, if we're not finished by then, we'll announce and let you know if we're going to have to come back later in the afternoon. We're going to get started this morning with our vote-only agenda, and we'll begin on issue 1, the health-related general fund investments, pages 4 and 5 of the agenda. We're going to take votes by each individual item.
We could do 1 and 9 and then the rest.
Actually, what we're going to do is we're going to vote on items 2 through 8, and then we'll take a separate vote on items 1 and 9.
I move 2 through 8.
2 through 8?
Mitchell?
Hang on one second. Items 2 through 8, interpreters for Medi-Cal, AIDS Medi-Cal waiver program rates, drug overdose, hepatitis initiatives, children's dental disease prevention, early detection, diagnosis of Alzheimer's, biomonitoring program. Those are items 2 through 8. I'll entertain a motion.
So moved.
Roll call, please.
Mitchell?
Aye.
Monning?
Aye.
Stone?
Thank you. Items 2 through 8 are out on a 3-0 vote. I'll now entertain a motion on items 1, Medi-Cal estate recovery, and item 9, End-of-Life Act, Option Act telephone line.
So moved.
Roll call.
Mitchell?
Aye.
Monning?
Aye.
Stone?
That's out with a 2-1 vote. Item 10, Office of Statewide Health Planning and Development. I'll entertain a motion.
So moved.
Mitchell?
Aye.
Monning?
Aye.
Stone?
That's out with a 3-0 vote. We'll move now to item 0530, the California Health and Human Services Agency, issue number 1. I'll entertain a motion.
So moved.
Mitchell?
Aye.
Monning?
Aye.
Stone?
That's adopting placeholder trailer bill language, correct?
Yes, sir, it is.
Yes. Thank you.
That's out with a 3-0 vote. Moving on to the California Health and Human Services Agency, issue 1,
So moved.
restructuring the California Office of Health Information Integrity. The motion has been made. Please call the roll.
Mitchell?
Aye.
Monning?
Aye.
Stone?
That's out with a 3-0 vote. Office of Systems Integration, issue 1, Meds Modernization Multi-Department Planning Team. I'll entertain a motion.
So moved.
Mitchell?
Aye.
Monning?
Aye.
Stone?
That's out with a 2-1 vote. Issue 2, Management Information System Project. I'll entertain a motion.
So moved.
Roll call.
Mitchell?
Aye.
Monning?
Aye.
Stone?
3-0 vote. Issue 3, Cal HERES. I'll entertain a motion.
So moved.
Roll call.
Mitchell?
Aye.
Monning?
Aye.
Stone?
That's out with a 2-1 vote. Moving on to item 4140, the Office of Statewide Health Planning and Development, issue 1, expansion of state loan and allied health repayment programs. I've heard a motion. Please call the roll.
Mitchell?
Aye.
Monning?
Aye.
Stone?
3-0 vote. Moving on to item 4150, Department of Managed Health Care. There are 8 issues under this department. Issue 1, infrastructure and support services. I'll entertain a motion. Thank you. Roll call.
Mitchell?
Aye.
Monning?
Aye.
Stone?
Out with a 2-1 vote. End-of-Life Option Act.
So moved.
Roll call.
Mitchell?
Aye.
Monning?
Aye.
Stone?
2-1 vote. Issue 3, Federal Mental Health Parity.
So moved.
Roll call.
Mitchell?
Aye.
Monning?
Aye.
Stone?
That's out with a 3-0 vote. Issue 4, Large Group Review Rate.
So moved.
Roll call.
Mitchell?
Aye.
Monning?
Aye.
Stone?
That's out with a 2-1 vote. Issue 5, limitations on cost sharing.
So moved.
Roll call.
Mitchell.
Aye.
Monning.
Aye.
Stone.
That's out with a 3-0 vote. Issue 6, outpatient prescription drug formularies.
So moved.
Roll call.
Mitchell.
Aye.
Monning.
Aye.
Stone.
That's out with a 2-1 vote. Issue 7, provider directories.
So moved.
Roll call.
Mitchell.
Aye.
Monning.
Aye.
Stone.
That's out with a 3-0 vote. Issue 8, vision services. So moved.
So moved.
Mitchell.
Aye.
Monning.
Aye.
Stone.
That's out with a 3-0 vote. Thank you, gentlemen. We're moving on now to item 4260. We're on page 10 of the agenda. Department of Healthcare Services, there are 14 issues that we will take up individually. The first being county eligibility administration funding and trailer bill language.
So moved.
Roll call.
Mitchell.
Aye.
Monning.
Aye.
Stone.
That's out with a 2-1 vote. Issue 2, health insurance portability. I'll entertain a motion. It's been, thank you. Roll call.
Mitchell.
Aye.
Monning.
Aye.
Stone.
3-0. Issue 3, specialty mental health services oversight.
So moved.
Roll call.
Mitchell.
Aye.
Monning.
Aye.
Stone.
That's out with a 3-0 vote. Issue 4, performance outcome systems for Medi-Cal specialty mental health services.
So moved.
Roll call.
Mitchell.
Aye.
Monning.
Aye.
Stone.
3-0. Issue 5, Mental Health Services Act, Prop 63 reappropriation. Roll call.
Mitchell.
Aye.
Monning.
Aye.
Stone.
3-0. Issue 6, Drug Medi-Cal Waiver Program Resources.
So moved.
Roll call.
Mitchell.
Aye.
Monning.
Aye.
Stone.
3-0. That gets out. Issue 7, Drug Medi-Cal Residential Treatment Services.
So moved.
Roll call, please.
Mitchell.
Aye.
Monning.
Aye.
Stone.
Thank you. 3-0. Issue 8, Home and Community-Based Services Federal Requirements.
So moved.
Roll call.
Mitchell.
Aye.
Monning.
Aye.
Stone.
That's out. 3-0. Issue 9, Office of Family Planning Contract Conversion.
So moved.
Roll call.
Mitchell.
Aye.
Monning.
Aye.
Stone.
That's out. 2-1. Issue 10, Medi-Cal Estimate May Revise Adjustments.
So moved.
Roll call.
Mitchell.
Aye.
Monning.
Aye.
Stone.
That's out. 2-1. Issue 11, Medi-Cal May Revise Adjustments to January Budget.
So moved.
Roll call.
Mitchell.
Aye.
Monning.
Aye.
Stone.
That's out. 2-1. Issue 12, Hospital Quality Assurance Fee Extension.
So moved.
Roll call.
Mitchell.
Aye.
Monning.
Aye.
Stone.
That's out. 2-0. Issue 13, Medi-Cal Electronic Health Record Staffing.
So moved.
Roll call.
Mitchell.
Aye.
Monning.
Aye.
Stone.
That's out. 3-0. Issue 14, Family Health May Revise Estimate.
So moved.
Roll call.
Mitchell.
Aye.
Monning.
Aye.
Stone.
Thank you. That's out. 3-0. The next item, 4265, Department of Public Health. We're going to take issue items 1 through 7 up in one motion. I'll entertain that motion. Thank you. Roll call, please.
Mitchell.
Aye.
Monning.
Aye.
Stone.
That's out. 3-0. File item 4300, Department of Developmental Services, issues 1 through 9. I'll entertain a motion for all 9. Roll call.
Mitchell.
Aye.
Monning.
Aye.
Stone.
That's out. 3-0, all 9 issues. Item 4560, Mental Health Services Oversight and Accountability Commission. We'll take the issues up individually. Issue 1, Investment in Mental Health Wellness Act. Roll call.
Mitchell.
Aye.
Monning.
Aye.
Stone.
3-0. Issue 2, Innovation Plan Reviews. Roll call.
Mitchell.
Aye.
Monning.
Aye.
Stone.
That's 3-0. Issue 3, Advocacy Contracts.
So moved.
Roll call.
Mitchell.
Aye.
Monning.
Aye.
Stone.
That's out with a 2-1 vote. Issue 4, Reappropriation of Mental Health Services Fund.
So moved.
Roll call.
Mitchell.
Aye.
Monning.
Aye.
Stone.
That's out. 3-0. Moving on to our final vote only item, our final item on the vote only calendar. The California Health Facilities Financing Authority and the Mental Health Services Oversight Accountability Commission. We've had a motion. Please call the roll.
Mitchell?
Aye.
Monning?
Aye.
Stone?
That's out 3-0. Thank you, committee members. We will now begin our items for discussion section of the agenda, starting on page 29 of the agenda, and ask representatives from California Office of Health Information Integrity to come forward. Good morning.
Good morning. My name is Elaine Skordakis, and I'm the Assistant Director with the California Office of Health Information Integrity, also known as Cal-OHI. With me is Jennifer Schwartz, our Chief Counsel. Good morning.
Good morning.
Cal-OHI is requesting $800,000 spending authority. We anticipate to receive grant funding from the California Healthcare Foundation. With this funding, we will develop non-mandatory guidance that standardizes the understanding and compliance with state and federal law related to mental health, substance abuse, HIV/AIDS, and behavioral health data. The guidance will better inform conversations about care coordination and data sharing, both within and outside state government. The guidance will facilitate the movement of data for improved care, lower costs, and better outcomes. Do you have any questions?
Any questions, colleagues? Seeing none. LAO? Finance? Thank you. Any public comment on issue number 1? Seeing none, I'll entertain a motion to approve and adopt placeholder budget bill language. Please call the roll.
Mitchell?
Aye.
Monning?
Aye.
Stone?
Thank you very much. That's out with a 2-1 vote.
Thank you.
Thank you. Moving on to item 4300, Department of Developmental Services. We'll begin with issue 1, the Sonoma Developmental Center decertification of the ICF IDD.
Okay, good morning. I'm Nancy Bargeman. I'm the Director of the Department of Developmental Services, and today I have with me John Doyle, the Chief Deputy Director, and also Dwayne LaFawn, Deputy Director of the Developmental Services Division. So in order, regarding issue 1, want to be able to address the issues that are outlined in the agenda today. We did receive notice on Friday from the Federal Center for Medicaid and Medicare Services, also known as CMS, make it easier to refer to that throughout this discussion, that they are not extending the settlement agreement that would have continued the federal funding for the 7 units at Sonoma Developmental Center. Just to remind you, the 7 units are a part of 11 units of the ICFs at Sonoma. 4 of the units back in 2012, we voluntarily relinquished the certification. So these are the additional 7 units. Also, to just refresh your memory that part of that agreement is that 161 of the individuals at Sonoma were a part of the settlement agreement. Of the 161 individuals, we have 136 that remain at Sonoma today. Well, we've had an enormous amount of improvement over the time at Sonoma. The staff have worked tirelessly to improve those services. Back in 2012, we had 6 conditions of participation that were out of the 8 of the federal requirements. As of the recent survey in February, we had 3 conditions of participation that was out, and that is what was referenced in the letter that was sent by CMS. So those 3 areas of participation that were out during the last survey in February include client protection, and included under client protection is the immediate jeopardy that was identified during the survey, also active treatment and governing body. Dwayne LaFawn is going to briefly just give you an overview of the corrective actions that have been taken since the survey, as well as what's currently in place. But before we do that, we want to just give some assurances, not only to this committee, but also to other stakeholders, the commitment of the department and of the staff at Sonoma, as far as assuring the quality of services and continued improvement of services at Sonoma. And certainly the individuals that are there is certainly our priority to make sure that as they call Sonoma their home, and prior to and during the time that they transition to the community, that we provide those services and supports.
Good morning, Dwayne LaFawn. As noted, the main finding in the survey back in February was an immediate jeopardy that occurred when an individual was found not receiving continuous oxygen in compliance with their plan. At the time of the discovery, the individual was assessed and his oxygen levels were within range and no harm came to the individual. However, the jeopardy was cited because of the potential for harm. Surveyors immediately investigated other residents who use oxygen in all other areas were found to be in compliance with the policy as written, indicating that the incident was isolated. However, correction plan was immediately implemented and the jeopardy finding was removed during the survey in February. During that time, other involved staff who were involved in that were reassigned to other areas pending investigations and outcomes. Based on feedback received during the survey, Sonoma began working on additional plans of correction and subsequently received their formal findings, what we call 2567s, in April 22nd of just last month. This was when we found out that the survey team had found 3 of the 8 conditions were not met. The DCs, again, do note issues very seriously when they occur during surveys, and so they continue to address these through plans of correction in the survey. So if I could, I'd like to highlight some of the actions they took from the plan of correction, specifically with health and client protections. They have had and continue to assign clinical registered nurses to each of the ICF residences and provide ongoing training to monitor nursing activities. They have revised their training curriculum to include competency-based evaluation for registered nurses, psych techs, and psych tech assistants. The oxygen policy, tank, and documentation form were revised for clarification, and staff were trained on competency-based techniques for that. And the coordinator of nursing services department continues to ensure compliance with health plans and oxygen administration. In addition to that, again, some staff corrective and adverse actions were initiated regarding nursing issues that were identified in the survey. Also, some risk management systems regarding incidents were revised to assure administration. Investigation, an administrative investigation is completed within 5 days and reviewed by the executive staff to assure that the responses to the investigations are complete and appropriate. An incident action team now reviews event reports at a 5-day mark to make sure that the loop is closed on after actions and make sure that immediate protection needs are addressed. The Quality Assurance Department tracks and reports on the timeliness of notifications and reports to the Executive Director and the Clinical Director daily. And then the Human Rights Committee has going to readdress what's referred to as a whole person review process to ensure a complete review of any access issues and how an entire rights access program trains for personal choice and independence for people to have access to personal items, which was one of the issues cited under client protections. Corrections in the active treatment area include revising an assessment regarding independent living skills so that it emphasizes community transition skills in a greater area so that we make sure that the IPP includes any plans for readiness skills that are needed for the person to transition on into the community. Individual program coordinators who are responsible for the coordination of the individual program plan, and residence managers coordinate the oversight and implementation of those person-centered plans, and they check staff knowledge on the individual plans now. An active treatment team revised staff training curriculum, and along with program managers are coaching and monitoring staff to ensure each person's individual program plan is being carried out as written. The active treatment team will be reviewing competency of staff after training in the work environment, and those staff not passing the competency test will be required to attend remediation training until they pass. And in the governing body area, the governing body is developed and revising the plan of correction in an ongoing way, is out checking to make sure it's being implemented appropriately, and is responsible for assuring that staff are aware of the plans and making the corrections. And they'll continue to review and revise strategic objectives to ensure progress continues to be made and that goals are met. And I can take any questions you'd like.
Thank you, Madam Chairwoman. There's 136 remaining patients at the facility. How many employees are overseeing those 136 patients?
I'll have to check on that. I'd say it's about 2,000.
2,000? 2,000?
We'll get it for you. I may be mixing up.
Greater than 1,500?
Greater than.
Just to clarify, as far as the total population at Sonoma, though, is 352.
Okay. And how many personnel do we have overseeing all those patients?
Okay.
1,274. So it's about a 4-to-1 ratio, roughly, staff to patients.
Can I ask a clarifying question
Sure.
on your question?
Yeah.
Because as we just got clarified, it's 136 residents in the ICF IDD unit. How many staff are in that unit? Trying to get the staff to the patient ratio in this unit in
Supports the
question.
161 that we're,
Yes.
actually,
Yes.
the 132 that we're referring to.
Yes.
We don't have that today, but we can certainly get that for you.
Thank you.
Okay. So we originally were cited by CMS. We had a certain period of time to come into compliance. The original complaint was filed back when?
The original survey occurred in June, I believe it was June of 2012, was the original survey that triggered the findings and the corrective action and the process that we move forward with.
So it's very clear that we were under a microscope by the feds to ensure that we were in compliance, and yet even after we came under the microscope, we still fell short of 3, it sounds like, very serious issues of client protection, jeopardy, active treatment. And the downfall for the state is, well, number one, we're not protecting the patients the way they should be protected is the number one thing. But number two, the state's being penalized by $26 million now. I appreciate the corrective actions that are being taken, but, why are we talking that prospectively instead of, before? I mean, we lost $26 million. Is that something your department's willing to absorb, or are you looking for the state to make you whole on that $26 million? And is there an appeal period showing the federal government that we've taken corrective action and we can recover that $26 million?
Senator Stone, members, John Doyle. When we signed the agreement, the settlement agreement with the Centers for Medicare and Medicaid Services for Sonoma, we waived any right to appeal. And so we don't have an appeal process. Obviously the news is fresh, and we're still looking at cost estimates. The cost estimates we provided of approximately $2.2 million per month were based on 13-14 cost data. We have updated data, so we're looking at cost estimates, and we're discussing it with the Department of Finance on how we would move forward on this. So we don't have an answer for you right now. We obviously absorbing $26 million within our developmental center budget would be difficult.
Okay, so after significant warnings, how is it that we still didn't come into compliance? Where did we fail?
And we can have Dwayne provide a little bit more detail as far as the specific areas. So just kind of high level, there's 8 different areas, and not giving any excuses, because we certainly share the concern, and the safety of the individuals at Sonoma is of utmost priority. So of the different conditions of participation that's required to be able to secure the federal funding, the original findings were 6 of those conditions that were out. Over time, there's been a number of plans that have been put in place to ensure safety and protections. And so including in those protections, there still were areas of compliance that still needed to be worked through. And over this period of time, while there was notable improvement, and you could really see the improvement based on the efforts that the staff have made, and we can provide that outline to you, we'd be happy to do that. There still were those 3 areas that were identified during the survey in February. And again, not minimizing it, but we can really show where some improvements really have gone in and where the seriousness of making sure that individuals are safe is of utmost priority for us.
You know, I'm always happy to compliment staff when jobs are done, well done, and I try my best to support good work. But I'll tell you that if I have an inspector that came into my pharmacy and noted some safety concerns and brought it to my attention and said he was going to follow up in 30 days to make sure that I took corrective action, my license is on the line. And I'm going to take those recommendations to heart because it's in the best interest of patient safety, which is of utmost importance. So I regret that we had a significant failure here. That put patients in jeopardy, and now when our receipts are coming in now a little bit less in the state at a time when we're spending a lot of money at these developmental centers on a small number of patients that can otherwise be treated much less expensively in a community in this transition period, is just very disappointing to know that we're going to be operating with $26 million less, and I think you're coming here with an open hand, expecting us to take $26 million out of the general fund. It could be used for optometric services, to be covered on Medi-Cal, physical therapy services. I mean, there's so many other things that we could use this $26 million for that I would rather have the feds pay for. It's just regretful that we're passing this up. We're not going to get it. So I urge you in the future, when you are warned by the feds that we're not in compliance, that we double check and triple check and go through exercises to make sure that we're in compliance. And number one, again, in the best interest of patients, but number two, we depend on federal funding to operate the state in many different facets, and this is an apparent failure that we need to never have happen again.
Thank you, sir. Senator Monti.
Thank you, Madam Chair. Just to take a step back to review, there was 7 units out of a total of 11 that were subject to the federal scrutiny. Is that correct? And then you mentioned 2 were voluntarily removed. Was that 2 out of the 7? Or
Actually, there's 11 total ICF units. So we have additional units in the nursing facility. So of the 11, the 7 were a part of the settlement agreement. We had voluntarily relinquished the certification for 4, and that was back in 2012.
So that's 4 of
The 11.
the 11, leaving 7.
Correct.
And those are the subject of the current
Settlement agreement.
settlement agreement.
Correct.
And just another point of clarification, I know you're going to get us staffing information, but I think it's important to note when you discuss staffing ratios, are there 2 or 3 shifts run 24 hours? Is it a 3-shift?
Yes, it's a 3-shift rotation.
Right, so when you discuss total staffing, it's not, you don't just take patients into that total. It has to be per shift to get the ratio. Is that accurate?
Right.
And then I share the concerns voiced by my colleague, Senator Stone, in terms of what it means to look to the general fund to replace this funding. But again, I think part of our rationale has to be what is necessary to protect these patients, not to excuse malfeasance or the inability to come into compliance. But I would hope we don't penalize the patients out of a desire that that necessary funding could be going somewhere else. I think we need to, as this committee and as the legislature, our first obligation has to be to the ongoing safety and protection of those patients. So that's all I have for right now. Thank you, Madam Chair.
Thank you. Let me go ahead and have you respond to questions 3 or 4 and then I'll have some questions as well, so if you
Okay, thank you. So for question 3 is regarding the, if the current notification regarding Sonoma, what that impact would be on the settlement discussions for Porterville and for Fairview. We do see each of the developmental centers as separate entities, and as such, of seeing them as separate entities, we would anticipate that the agreements would also be seen separately. So while we don't have current feedback at this time, we don't see the impact of the Sonoma action impacting the Fairview or Porterville. So we would see them as separate and not have that impact.
So I appreciate that you see them as separate. The question is, does CMS see them as separate?
We've not heard otherwise. And then for question 4, so prioritizing the identified providers or placements for the other 100 individuals. So going back to the 161, recognizing that we have less than the 161. So knowing that there's 100 of the individuals of the 136 remaining, that we have 36 of those individuals with identified providers. We do see opportunities on focusing on efforts for the 100 individuals, while we still have a responsibility for every individual at Sonoma and making sure that we're supporting the development and the transitions. There are some things that we can do as far as focus. We can look at the resource development and ensuring that we're really developing the resources, because we do know today of the 100 individuals what types of services that they need. They may not have selected a provider, but we can certainly take a look at how to increase that development and make sure that's being achieved quickly. The other area in which that we can focus on is setting up the meetings with the families to have them start identifying the providers, because providers have been identified through the regional centers in their development, so we can encourage that development and focus those. The other thing we can do is update the comprehensive assessments for those individuals, the 100, to make sure that we have very clear and updated assessments to have assurances that we're focusing on the appropriate resources for development. So again, I think that there's a number of areas that we can do while we're still supporting the other individuals in their transitions from Sonoma.
Senator Stone.
Yeah, I certainly appreciate Senator Moning's conclusion that we don't want to take away funding that is going to jeopardize or exacerbate the issues going on at Sonoma. But there has to be some accountability for this. So was there any admonishment of any senior management staff that was overseeing this? Or is it just, we'll just get along and go along?
Oh, no, we certainly appreciate the concern. And as Mr. LaFawn had outlined, at the moment of the survey back in February, recognizing some of the issues that were brought to our attention, there were actions taken as far as with staff and making sure that there were appropriate actions taken, considering the seriousness of the issues. As far as the findings from the letter, we've not done any additional actions. We just received it Friday. However, we know what the findings are from the survey. And so the actions that Mr. LaFawn has outlined for you are the areas in which we've taken seriously and taken action, not only on personnel action, but also in making corrective actions on the issues.
Well, Madam Chair, I would like to believe that we're going to see staff that is going to be held accountable for this, and I would suggest that we go with the normal appropriation, and then at mid-year, when you need funds, we come back and reevaluate our situation and ensure that we have progress in patient safety and make a supplemental appropriation at that time, if that is something that my colleagues can agree to.
Thank you, Senator Stone. We can have a bit of a discussion about that. Anything else you want to add to the questions before we continue our conversation?
No, not
Okay.
at this time.
You know, I would just say I have to agree with comments made by both of my colleagues. I toured Sonoma, and prior to my own tour of Sonoma, I had not read or was not familiar with the previous survey findings. And I walked into Sonoma with a naive assumption. And my assumption was the prior challenges with CMS were probably structural. Given the age of Sonoma, again, my uninformed assumption was that the challenges were the physical plant, and recognizing that it was constructed decades ago, that perhaps the physical plant wasn't conducive to our current best practices and our current understanding of best practices in terms of providing services to the developmental center population. But on my tour there, I learned that was not the case, that there were other issues. What troubles me deeply is at this committee's hearing just a month ago, when we asked the question where you thought we would come out on this, I got a sense from you and others in your department there was a high level of confidence it would be okay. To come back Friday and find that we're not, A. B, a finding of immediate jeopardy, even an institution of that size, the various challenges one has in running an institution, any institution, a finding of immediate jeopardy for me is inexcusable. I mean, I just don't see how we get around with the multiple shifts, given the current staff to patient ratio, a finding as core to the roles and responsibility of every employee on that site, something as basic as an oxygen tank not operating, is deeply, deeply troubling. And when I consider all that we have to do in the next few years, in partnership, the legislature in partnership with your department, to guarantee the safety of California residents in the transition out of the DCs, now was not the time for our collective confidence to be shaken to the degree that it has. I just have to be very honest with you. In addition to the financial burden, there's no question that this puts upon the state at a very, very challenging time when we have heard incredible investment opportunities in this committee alone, of all the budget subcommittees in both houses. To have this kind of loss now is crippling. So I just want to open it up to you to ask you, what can you say to us on a go-forward basis? Because I am deeply concerned about Sonoma and the department's ability to manage these transitions into the future. You have a lot of balls in the air, and as do we in our oversight responsibility as the state legislature.
Thank you. We share your concerns, and looking back, there's certainly with the surveys and the outcomes of the surveys, there's nothing that we would say that is not alarming. Absolutely share those concerns, and share the concerns and ensuring of making sure that those corrective actions are done, immediately, and the efforts that have already been made that will continue to be made are going to continue as a priority. When we take a look at the development and the planning that is going in, while the concerns are absolutely there, and I'm not going to minimize that, but I do have an enormous amount of assurance with the investment that the legislature has put in, and also the work that the regional centers are putting in as far as developing the community. We've invested and have approved a significant amount of the community placement plan funds. Not only do we have the base funding that has been in prior years for statewide of about $68 million, there's been additional funding that has been invested to have assurances that we can expedite the development. And meeting with the regional centers last week and the week before, I've been meeting with the Sonoma Regional Center directors by phone to go through each of the developments to have assurances that we're on target. Are we delayed in some of those developments? Yes, we are. I am aware of some of the challenges that they're facing. We do understand that they're facing some of the challenges as far as achieving city permits, that they're having some interpretation of some of the fire codes in the development. There's some efforts that they have to continue to work on with our support, to make sure that they can overcome those hurdles. We have increased, as a department, the oversight and support to the regional centers as they're developing those resources. So as we're doing this, we're still doing our monthly calls that we have with them. We're meeting as a department on a monthly basis with the executive directors face-to-face to walk through each of the developments. This is not only for the residential models, but it's also for the community development, because there's more to just residential in preparing the community for the individuals that are transitioning. So to your point, we have a lot of balls in the air. We have a lot of things, I call it spinning plates, and we have to make sure these plates don't drop. So as we're looking, and very strategically looking at how we're going to be approaching each of these spinning plates to have assurances that we're moving forward to ensure, A, that we can develop the resources so we can transition individuals, but also do it in a way that is very thoughtful and safe for the individuals transitioning. So in addition to the development side, we are also being extremely mindful of how we're working with the families and the individuals to monitor the acuity levels, to make sure that we're transitioning individuals to the appropriate resources in the community. Some of the efforts that the Developmental Centers Division has done in providing that assurance with the support of the legislature is looking at how we have some of the staffing patterns to support those transitions. So we do have like another 150 individuals that are included in the Sonoma, in the staffing, to make sure that we have that staffing to be mindful of providing that oversight and support during those transitions. So as we're moving forward, I'm keeping an eye on it. We're having the deputy director keep an eye on it. We have the opportunity of assessing our current independent monitor contract to see how we can continue to apply that oversight from another set of eyes to have some additional assurances that can help inform me as to what's occurring at Sonoma. So, I realize this is a little bit of a long-winded answer, but it's a big issue. And so we have the commitment not only to focus on this, but also to keep you informed as to the progress and also to the barriers. If we're facing any barriers or challenges, we have the commitment to share those with you so you can really see where we are in that process.
Ms. Bergman, quick clarification for me. The immediate jeopardy scenario with the oxygen, was that a failure of equipment or a failure of staffing oversight?
Staffing oversight.
Okay. We've spent a lot of time with regard to the closing of Sonoma, with all of the closures, talking about personnel and how they would be transitioned in the process. A lot of time in creating opportunities for them to transition with the clients who they have longstanding relationships with into the community. And I hope that in our ongoing conversations about that we are indeed talking about the best and the brightest, those who have the capability and the capacity to do a job well.
Absolutely. And if I could just respond to that real quickly, one of the nice, the part of the community state staff is that the provider has the opportunity also to interview. So we can work in collaboration with the regional center and the provider to have assurances as far as reference checks and making sure that as they're interviewing that they've done their diligence as far as how that particular staff person can appropriately fit and support in the community.
Do the clients have a voice in that as well?
Absolutely. Yeah. There's relationships that have been built, and so you'll see a lot of dialogue on many facets of those transitions to include staffing patterns as well.
Because the goal from my perspective shouldn't necessarily be 100% guaranteed employment, but guaranteed employment for the individuals who are trained, equipped, qualified, and have exemplified their ability to do the job well.
Thank you.